Hi, today we're going to be discussing a new understanding of healthcare, burnout, and a new solution. I'm Dr. Ron Wuest, a psychiatrist of 33 years, and I've created or directed some of the largest private mental health organizations in the country. During those years, I worked with a large number of healthcare professionals, helping them with burnout. As time passed, I became so frustrated with the corporatization of medicine that I left formal practice, and now I'm devoting the next stage of my career to helping healthcare professionals recover from burnout. I'm doing this by helping them achieve emotional well-being, create financial freedom in less than 15 minutes per day. Estimates of burnout and suicide now for physicians are approaching about 54% on burnout, and physician suicide shows a huge increase. 400 physicians per year commit suicide. Males are 40% higher than the general population, and females are 130% higher than the general population. Consensus definition of burnout contains 3 cluster symptoms. 1, emotional exhaustion. 2, depersonalization, or a feeling of being disconnected from patients. And 3, a reduced sense of personal accomplishment and joy at work. The gold standard of measurement of burnout is the Malish Burnout Inventory, or MBI. And this is a 22 self-report scale which can be found on the internet. Consequences of burnout are so significant to healthcare professionals, patients, and the organization as a whole. For patients, there's an increased risk of medical errors and the consequences that ensues from that. Poor patient satisfaction. For the organization, there's physician disability. There's decreased physician productivity and higher physician turnout. And the cost of replacing one physician over a year is estimated to be about $1 million. Finally, the risk to healthcare professionals are decreased satisfaction and potentially less people being interested in medicine in general. Depression, anxiety, substance abuse, marital and family dysfunction, of course, suicide, and then leaving the profession early. The literature suggests 2 target treatments for burnout. These just aren't working. The first is directed at helping physician resiliency efforts, coaching, mindfulness, cognitive behavioral therapy. But why should we ask healthcare professionals to cope with an unhealthy system to begin with? The second is targeted at the root cause of the problems in the organization. And this is where 80% is thought to be attributed to, such as improving work conditions, less hours, more pay. However, we can't expect the very organization who's created this problem to be the ones to fix it. Healthcare professionals, like all of us, want to live more meaningful lives. We're tired of spending nights and weekends charting, answering phone calls, inbox messages. They're missing their children's activities, letting their relationships with spouse, children, friends go by the wayside. Physicians are tired of repaying debt to get educated, and now they're making less and less. Many are living paycheck to paycheck. We all know this is no way to live our lives, but we don't see a way out. And this is why I've created my YouTube channel, a channel specifically designed for healthcare professionals to help them live their best lives. So why do healthcare professionals get burned out in the first place? Intuitively, we all understand as professionals that if we made a little more money, this would allow us the freedom to better shape our lives in a manner consistent with our values. So we work a little harder to improve our income, but the amount of time we end up spending working further disrupts the very balance that we're trying to achieve. We spend less time with family, less time taking care of our physical and emotional needs, less time available to enjoy our lives. This becomes a double bind and burnout ensues. So what is the answer to burnout? Working harder and harder will not solve the problem. Giving up on a balanced and meaningful life isn't the answer either. We must change our strategy. We need to stop thinking that somebody else is coming to the rescue because the cavalry is not coming. And my channel is devoted to teaching and helping healthcare professionals take personal responsibility to work less, make more, and nurture their emotional well-being with proven strategies that have helped hundreds of healthcare professionals. Since I retired from the formal practice of medicine, my income is actually double what it was, and I'll show you if I can do it, you can do it. We've got to make this shift and stop working nights and weekends. Stop missing time with your spouse and family. Stop living paycheck to paycheck, and stop being burned out and exhausted. We would never suggest living this way to our patients, so why are we doing this in our own lives? So join me on my mission to help physicians and healthcare professionals live a meaningful life and stop this insanity. Click on the link below for this totally free financial masterclass designed specifically for healthcare professionals called Living Your Meaningful Life. It's absolutely free. You have everything to gain, nothing to lose. So click the link below and start living the life you deserve today.